All right. Well, thank you for taking the time to watch this webinar this morning or today, whenever you're watching it. I'm going to talk about primitive reflexes, learning issues, especially related to reading issues. I have had the great pleasure of working with hundreds of kids with reading issues, um, and something that you find that is consistent with all of them is they still have retained primitive reflexes. They still have eye tracking delays or eye tracking issues. And when those are resolved, many of those kids' issues related to reading and learning improve dramatically. There's also some aspects of visual interpretation or visual processing, auditory memory, visual memory, those types of things you can play into as well. But the vast majority of them simply have primitive reflexes that should have gone away really within the first year of life, and then it affected their eye tracking, and they can't physically track a line, which I'm going to show that to you today. I'm going to show you a bunch of different kids, how their eyes move pre and post having primitive reflexes. So the main ones I'm going to talk to you guys about today is the one right in the middle there called the Asymmetrical Tonic Neck Reflex, the one at the very bottom called the Symmetrical Tonic Neck Reflex, and one called the MORO Reflex, or a fight or flight response. The MORO reflex should go away right around 2 to 4 months of life, or should be integrated. When it doesn't go away, it creates a lot of hypersensitivity, a lot of reaction, behavioral outbursts, impulse control issues, attentional issues. So that's why we're going to talk about that one, is because it's more related to the attentional aspect, not necessarily as much to the physical eye movement aspects. The asymmetrical tonic neck reflex, it should go away right around 6 months of age. It plays a lot into eye tracking from side to side, and when you look at these kids, you'll typically see skipping in their vision when they track their eyes from side to side. It plays a lot into alignment from side to side of their eyes, um, and it plays a lot into the ability to cross midline of their body. Most common symptoms with it are actually difficulties learning to crawl. So uh, they'll typically start to walk right around 9 months because they'll crawl for a very short period of time and it's very challenging and not a smooth movement for them. So then they'll just stand up and start to walk is a very common thing that you see. And that doesn't mean, and a lot of parents think, oh, my kid walked at 9 months, they're really advanced. It's actually that they just missed a step of development because they still had a reflex. Um, the and they'll typically have poor balance. They'll have difficulty learning to tie their shoes, riding their bike, handwriting, and reading are very challenging. They don't have to have all of those, but those are the common symptoms that I see in my office. The symmetrical tonic neck reflex is a reflex that should go away right around 9 to 11 months. Plays a lot into posture when sitting. They'll have really slumped postures typically, poor muscle tone in their back, poor hand-eye coordination. It plays a lot into the ability for them to track their eyes up and down, and then what's called converging and diverging their eyes, or bringing their eyes in together, bringing their eyes out together. So when that isn't well developed, what you'll see is when you can't converge your eyes, you'll get double vision, or you'll see two of everything. And it's kind of amazing. I'll show this to you. A lot of kids have that, but they they've had it so long, they had it their entire life that they don't realize that that's abnormal. And so seeing two of everything while they're reading, they think, hey, this is what everyone else sees, and it's not the case. That shouldn't be happening. But that's what you see in a lot of kids, and I'm going to show that to you guys today. There's a few different cases in here that's what's going on. Okay, the asymmetrical tonic neck reflex. I'm actually not going to show you this first video. This is what it should look like prior to 6 months. So what should happen is kid turns their head to the left, their arm on one side straightens, their leg on the same side straightens, and the opposite side, their arm flexes, This should be present until about 6 months of age to help them to develop hand-eye coordination, help them develop extension of one side of their body and flexion of the other side, and really help them to develop movement. But after about 6 months, this reflex should go away and that should stop happening. But what you're going to see in this child's case is the first thing I tested him when I bring his head straight down is called the symmetrical tonic neck reflex. So don't worry about that one yet. We're going to talk about that next. But the asymmetrical tonic neck reflex, I'm going to turn his head to one side. So I'm going to turn his head to the right, and what you're going to see is on the left, his arm is going to drop out. and then I'm going to turn his head the other direction, and his arm is going to drop out on the opposite side. But that's the same thing you're seeing here. When we turn the head to the left, the arm bends or drops out on the right side. So I'm going to show that to you here. There's no volume with it, but that's okay. So I'm going to bring his head straight down. You see his arms start dropping out. That's a symmetrical tonic neck reflex. That's the next reflex we're going to talk about. But this one, where I turn his head, drop his low back, turn his head, and on the opposite side, his arm drops out, and the more I do it, the worse and worse it gets. That's an asymmetrical tonic neck reflex, and that should go away at 6 months. You should be able to turn your head without your arms reflexively dropping out. And the reason why that one's important is because two things. That reflex needs to go away for us to develop eye tracking across the middle of our vision. And you'll see big skips in their vision when they have that reflex still present. Let me see if I can go to the next slide here. Oopsies. Nope, I don't want that one. That reflex should go away when right around 6 months. And if it doesn't, you get this big jumping and skipping in the middle of your vision. You get the inability to use your neck and your arms appropriately, so it plays a lot into handwriting issues. I'm going to show you a couple of other examples here, and the second one's actually a really cool one, but there is another way you can test it. You can test it standing, like you're seeing on the left here. So I'll show that to you, and then that second one is really cool. You get to see the difference in eye tracking. So when you test this, you turn the head to the left. Their arm should stay straight ahead, but what you see there is when I turn her head to the left, her whole body rotates with her and her arms rotate. She should be able to keep her arms straight and turn her head without her whole body moving. Well, if you still have an asymmetrical tonic neck reflex, you don't develop the ability to use your head independent of your body, so your whole body turns with you. So that's a lot of times the way you'll check it with adults or older children. Younger children, it's a little bit harder that way. This one is a pretty cool one here. So again, I'm starting out, I'm looking for a symmetrical tonic neck reflex, which we're going to talk about next, which he has. Both of his arms drop out there. And you'll see here, turn his head, opposite arm drops out, opposite arm drops out. And we're not turning hard, it's just as you start turning, their arms reflexively drop. And you'll get to see his eye tracking here. If you watch his eyes close, he can't track, anything. He's trying to track my finger, but his eyes reflexively can't follow it appropriately. And then this is actually just a couple days later. We adjusted him specific to his brain weaknesses, are specifically related to his asymmetry of his brain, which allowed him to start shutting down this reflex. And that's why you saw that reflex go away. But then what you get to see here is his eyes get super smooth, and he can now follow it, because when his brain shuts down that reflex, his eyes can efficiently track through the middle of his vision. And you're going to see that in a bunch of other cases here too. Okay, so the asymmetrical tonic neck reflex, in my opinion, it's probably the most important reflex that we have, and especially related to learning. It needs to go away, and a lot of kids it doesn't. It's really amazing how many kids come in with this reflex. I've never seen a kid with reading delays that doesn't still have this reflex. It helps us develop appropriate muscle tone, helps us develop hand-eye coordination, balance, eye tracking abilities, especially from side to side, helps us develop ability to cross midline, helps us to get out of the womb, helps us to army crawl, cross crawl, and walking. That's a big tip off that this reflex doesn't develop appropriately, is if a kid never army crawled. They should start army crawling right around 6 to 7 months. They should start cross crawling right around 7 to 8 months, and they should crawl all the way until a year, and then they should walk. If they don't hit that normal sequence, it's typically because of this reflex. Helps us to develop typical or normal range of motion of our cervical spine. So when it doesn't develop well, what you'll see as an infant as well is a lot of times you'll see something called torticollis, where their head is always turned to one side, feeding issues, rolling delays, crawling delays, walking difficulties. Symmetrical tonic neck reflex. I already showed this one to you guys, but this is where we bring his head straight down, drop his low back, bring his head straight down, and both of his arms start to want to drop out. And the more you do it, typically the worse it gets there. That's called a symmetrical tonic neck reflex. It plays a lot in development of our low back musculature, and it plays a lot into the development of our eyes, tracking tracking up and down, and then converging and diverging. The STNR helps babies lift and control their head from far distance focusing. It preps the infant for crawling. This reflex helps to link the upper and lower extremities to move together reflexively. Most common symptoms are squirming or moving, poor posture, slouching. Headaches from muscle tension is another really common one. Difficulties with reading and writing. Vision disorders such as convergence insufficiency, which is the ability to bring your eyes in efficiently together. When that doesn't develop appropriately, or you have that, you'll get double vision when your eyes come in together to read. Saccadic eye movements in the vertical plane or up and down eye movements they jump a lot. Saccadic means that they're not really smooth. They're not smooth. They jump instead of being smooth. Okay, so these are a bunch of videos of pre and post eye tracking with getting rid of primitive reflexes. So I'm going to kind of explain them. First one, this kid has an ATNR and an STNR, and you're going to see his eyes starting out here. He tries to look at you. Sorry, I think I've come out of frame here, but it'll come back. So when I have him, yeah, stop here. Another way to look at this is when you have an ATNR, it's really hard for them to fixate their eyes or keep their eyes stable when their head moves. That's what you're seeing here is I'm having him look at my nose and I'm turning his head and he can't keep his eyes stable on me. That's called an impaired vestibulo-ocular reflex. You see how hard it is for him to use his eyes. It's hard for me to even turn his head and for him to keep his eyes on me. And when he tracks his eyes, you'll see those big jumps and skips in his vision. Should be nice and smooth. Right there, big skips. Big skip. Big skip there. Then after getting rid of the reflexes, he can keep his eyes stable when we turn his head. And then his eye tracking is nice and smooth as well. And that being able to fixate your eyes and keep your eyes stable when your head moves is really, really important for attention. If you can't keep your eyes stable or eyes focused, you just can't focus. So that's another aspect there. We'll show you this one here. I'm not going to show you all of them, but there's a few different ones here. Let me jump ahead just a little bit to where we looked at his eyes. You guys have already seen this portion of his video. Okay. So when he tracks, he jumps there, there, there. Now he's starting to move his head to try to compensate for it. Big jump there, there. Bringing his eyes in. That looked okay. You can see those big skips up and down. That's from your symmetrical tonic neck reflex, typically. If you watch his eyes, he can't keep his eyes stable on me. So his eyes, when I turn his head, they come off of my nose. That's typical of an asymmetrical tonic neck reflex. After getting rid of them, his eyes are perfectly smooth. And this kid was actually diagnosed with severe dyslexia. After we got done working with him, his reading improved substantially. I mean, it was night and day different. Now he can fixate his eyes when we turn his head. Let's see here. I wish I could get volume on this one, but what you're going to see here is this little girl. This is actually on the same visit. So I'm asking her right now when she sees 1. So right now she still sees double of everything. And of course she's going to have reading issues and learning issues if you have double of everything inside of, I'm almost 8 feet away. There she says 1. And then so then I worked on her symmetrical tonic neck reflex. We did some adjustments. We did a few other things. And now I'm asking her if she sees 1 or 2. And what she says is she sees 1, 1, 1. This is on the same visit. 1, 1, 1, 1. So within the same visit, by shutting down that reflex, we got her to be able to see 1 again. And now learning is much, much easier for her. Obviously, if you see double of everything, you're going to have a big issue with learning. This is the same thing here. This kid, he has a convergence insufficiency. So I'm asking him if he sees 1 or 2. He still sees 2. Still sees 2. He's trying to make it 1 there. And then I have him put his head back to the middle. He still sees 2. And I mean, that's within 3, 4 feet. There's no textbook that you're going to put 4 or 5 feet away from a kid when they're trying to read or a paper or whatever. So everything that he has tried to learn in his life that is within a few feet of him, which is crazy, is he saw 2 of at all times. And people think that, oh, this kid, he can't learn, he can't whatever, but it's just simply because he sees 2 of everything at one time, which is really, really sad. But it's because he has a symmetrical tonic neck reflex. And once you got rid of that symmetrical tonic neck reflex, then what you'll see next is he can converge his eyes in, no problem. He doesn't see double of everything. He can bring his eyes all the way in and he gets double about there, which is really cool. And I mean, it's really, really, it's amazing how many kids I see that have this issue that has never been caught by their eye doctor. It really baffles me because it's such an easy problem to fix. In a lot of cases, you get rid of the primitive reflex. Sometimes they need a little bit of glasses with a little bit of prism in them or strengthening of their eyes to get that to develop. And within a month or 2, they're completely different learners. Okay, let me go to the next slide here. Okay, this also plays a lot into handwriting. So this is a kid that he had an asymmetrical tonic neck reflex. You can see his drawing. This was in November. So this is an older one, but I thought it was really cool to throw in here. November, and then in May. And you can see how much more, how much better it looks, how much more detail it has. I mean, obviously it's night and day difference, but that's just from simply getting rid of 2 primitive reflexes. Allowed his brain to start processing information more appropriately and to be able to put that on paper more appropriately. This is also handwriting in a child. You can see how it's changed. I think we started working on this child somewhere in December or January, but you can see how his handwriting has changed by simply getting rid of an asymmetrical tonic neck reflex. Okay, MORO reflex is the last one I'm going to chat about today. The MORO reflex is a startle reflex. It's a reflex that really should go away in the first few months of life. I always explain this as this is the one where you take an infant and you kind of drop quickly and their arms splay out like that, and a lot of times they'll start to cry. That reflex is meant to help us to start to activate and develop our sympathetic nervous system. But then what should happen is right on that 3-4 month mark is it should turn into a more appropriate reflex called a Strauss reflex, and you shouldn't see it anymore. It should start going away to that same extent. This one is a girl. This is a way to test it standing up. When I pull her back quickly, what you see is her arms come up. At this age, what you should see is we should be shutting down that startle reflex where your arms come up, and we should have developed what are called propping reflexes, where our arms go down to catch ourselves. Well, if this reflex is still present, it overrides those propping reflexes, and your arms come up when you startle. Oh, come on. Let me go to the next one here. The MORO reflex is really important when it comes to like attention and fight or flight responses and chronically being stuck in a fight or flight response. So this is an automatic reaction to sudden changes in head position, light, sound, touch, or temperature. It creates an instant arousal of baby's survival system or an automatic fight or flight response. When this reflex is elicited, the infant releases stress hormones, adrenaline and cortisol, increases breathing rate, increases heart rate and blood pressure. If it's not integrated appropriately, most common symptoms are sleep disturbances, difficulty settling into sleep, easily triggering anger or emotional outbursts, which that is by far probably the most common one that I see. Shyness, poor balance coordination, motion sickness, poor stamina, poor digestion, a weak immune system, because when you release adrenaline and cortisol, a lot of those are help you fight allergens. So if you're using it all abnormally, you don't have any left for your immune system there. Hypersensitivity to light, movement, sound, touch, and smell. Difficulties with vision, reading, writing. Difficulty adapting to change. Cycles of hyperactivity and extreme fatigue. Easily distracted, and difficulty with visual perceptual issues. This is a girl that came to me. When she came to me, she couldn't ride in a car longer than 5 minutes. She was having a lot of vision issues, which related into learning issues, and she had chronic anxiety because every time she moved her head or she moved too quickly, she startled. Her pupils dilated, heart rate went up, and she went into a state of fight or flight. She had been in vision therapy for a year and a half for convergence insufficiency, saccadic eye movements, and she had a MORO, an ATNR, STNR, and after we got rid of these reflexes, which only took a couple months for her, she graduated from vision therapy, which was great. After 1 month care, she wasn't anxious anymore. She could ride in a car for 2 hours, and she graduated from vision therapy. But what I'm showing you here is this is her balance with her eyes open. So this is her just trying to stand with her eyes open. When that MORO reflex helps us to develop our vestibular system. This is after just a couple weeks, but she can now balance. But that MORO reflex is really important for developing our balance centers. And when our balance centers are underdeveloped, you'll have motion sickness, you'll have anxiety, you'll have difficulties in busy places or things that have a lot of moving. Like you go to a mall and there's a lot of moving people around, you'll get anxious a lot of times. And then you'll have a lot of vision issues, which plays into learning difficulties. So that's all I have. I know that was a really quick breakdown. Those are the 3 most common reflexes that I find by far that plays into learning issues. And when we get rid of those reflexes, it is amazing what happens to kids learning. They skyrocket. They start picking up books for fun and reading for fun, which is such a cool thing to see. And it's really amazing what happens when you get rid of those reflexes. And it's something that really isn't that challenging to do. In our office, we can get rid of those in a month, maybe 6 weeks. Sometimes there's some more intense things you need to do to rehab the eyes. Sometimes there's, more involved, the more delayed a child is. But the baseline of getting rid of those primitive reflexes really doesn't take that long. If you're in our area, we're more than happy to help you out. If you're not, we have online programs to help you guys figure out how to help your kids at home. We always do online consulting, stuff like that if you need help. But I hope this helps you guys out. It's really important. And before you start doing, doing different learning tutoring and doing all those things and making a kid try to read and read and read until they learn it, make sure that these foundational things are there, because I can almost guarantee you that they're probably not. And once you get that foundation, it's like a switch flips and everything is so much easier and learning is so much easier and it becomes a joy. And the biggest thing that I hate seeing with kids is that they have been forced to try to read and try to read and try to read when they have these big deficits, and they just learn to hate learning, and which is so sad. And but once you get that foundation, that joy comes back, and they really enjoy learning again, because it becomes something that was a laborious task to them now becomes something that is very easy and very joyful, um, and they want to do it more and more and more, which is really, really cool. So hope this helps you guys. Have a wonderful day, and God bless.